The whole concept of fireside chats originated because I fly all over the country, and as much as I fly, I still don't really enjoy it. It's not very comfortable for me. And when the plane hits turbulence, I always just want the pilot to jump on and say, hey, this is what that turbulence is. Because sometimes just in understanding what you're experiencing, it makes it a whole lot more manageable to actually experience. So this concept of fireside chats was instituted throughout the state of Pennsylvania to help people be clear about all the changes that are taking place throughout this worldwide pandemic and the changes that are happening week to week in institutions. Now, I don't think any of us thought that with COVID, it would just go out with a whimper and there wouldn't be turbulence to experience. And with the rise of this Delta strand of COVID, which is more contagious, it is more transmissible than any previous strand of COVID, well, of course, we're going to experience some turbulence. And so I thought, who better to sit down with than Secretary Wetzel? And that's just what I did. So for this week's Fireside Chat, here's my interview with Secretary Wetzel. Secretary Wetzel, there's a reason why we decided to sit down and do this Fireside Chat for the state. Why is it?
Well, first of all, I did the first Fireside Chat and haven't done one since. And on a real note, I mean, we got to make some changes. I'm sure our staff and incarcerated people have heard of the Delta strain of COVID and the implications. You see the president talking about masking mandates again. You see people talking about mandatory vaccinations and this and that. So obviously, the Delta strain of COVID is new and different, and so we have to respond, which is what we've done. From my first Fireside Chat, I said, listen, when there's an African proverb that says, when the music changes, so does the dance. And even if you can't dance, if the music changes, you're supposed to change how you're dancing, right? And so, we got to change the dance. But the good news is we're in a far different place than we were when COVID first started. We understand this disease and how it behaves. Most importantly, we understand how to not have it spread. And by we, I mean all of us. I mean, it still goes back to making sure we're cleaning the heck out of everything, making sure that we walk on a house, you just smell bleach, right? It got to be clean. It got to be spotless all the time, whether you're vaccinated or unvaccinated. That's critical. We got to wear masks. We got to wear masks when we're inside around other people, whether you're vaccinated or unvaccinated. That's here to stay for the foreseeable future. I mean, we have to social distance and be smart, and especially like when we're eating or if we're in a control booth or those kinds of things. Those are the high risk periods. But we haven't, knock on wood, we've been able to control this since we got vaccinations. We've not had an outbreak since we've gotten individuals 28 days past their Johnson & Johnson shot, or 6 weeks or 2 weeks past their second Moderna shot, which ultimately means 6 weeks. And then they're, 8 times less likely to get the disease. Equally likely to spread this Delta, which is one of the reasons we're taking some of the steps we are, and why we're talking about masking still being a critical place. But the most important thing is that vaccinated individuals rarely experience symptoms. So we've vaccinated nearly 29,000 individuals. We've had 81 breakthrough infections. So you've heard breakthrough infections, right? And you hear 81, it sounds like a lot, but it's 81 out of 30,000, right? So it ends up being like less than 0.3% chance that you'll actually even feel a symptom of COVID if you're vaccinated. More importantly, there's a lower chance than that of you getting hospitalized. And ultimately, someone dying from COVID, it's so rare that an individual who has a vaccine. So that's why there's such a focus. You hear that both the president and the governor really saying, we're going to focus on vaccinations. That's because it keeps people alive. And our focus right now is how can we keep unvaccinated, incarcerated individuals alive? And that's why all the steps we're taking, that's why we're taking them.
I think that's the piece for people to hear. That is the main priority, is to keep people safe. And so to that end, we're taking steps and different things that they're going to see coming down the road, or that what things should they expect?
Yeah, so to be very clear, we're going to have both vaccinated and unvaccinated housing units, right? So if you're unvaccinated, we're not mandating vaccines. We're not mandating our staff to get vaccinated. We're not mandating inmates to get vaccinated at this point. We're just not doing that at this point. And I say at this point because, the president, the governor, there are decisions being made outside our department. Our department's plan is this. We believe that individuals who are incarcerated, who are unvaccinated, are at an elevated level of risk to get COVID, to get complications from COVID, to be hospitalized, and potentially to even die from COVID. And we have a responsibility to protect them. So they're only going to be on housing units with other unvaccinated individuals. And then you're going to have to cohort in that group. And the good news is we were able to calculate based on the risk of the rate of COVID in the community, based on how many cases we have in that facility, what kind of risk level you are, but based on the risk level. So if you're in a facility on an unvaccinated housing unit, that's at high risk. So you have an outbreak at your facility, for instance, or COVID levels are very high and you're in a red zone, you're gonna be in 4-person cohorts. And you've been there. It's not fun. Nobody's looking forward to that. We're gonna maximize your SL time. We're also, unfortunately, not gonna be able to do contact visits for individuals who aren't vaccinated. The risk is just too high of you getting sick or God forbid, dying from this. So you're not going to do that. I mean, to offset or mitigate that a little bit, we're expanding your access to video visitation. So if you're on an unvaccinated housing unit, you will have more access to video visitation, more slots available, more units available than individuals who are vaccinated and have the opportunity to do face-to-face visits. So those are the primary changes. If you were working, we're not going to have you working. You'll maintain your pay at the same rate, whatever your pay was. Again, we just can't have you in that risky environment. And this is not disingenuous. This is not sleight of hand. The reality is if you're incarcerated and you're unvaccinated, you have a significantly higher level of risk. And we have to, as a department, respond to that.
That's the piece I think that is so important. We've heard you talk about this throughout the whole pandemic, which is they're in a closed system and that they are at an elevated risk. And it is our job to make sure that we protect people in the best way possible.
Yeah, there's no doubt whatsoever. If you look at the 20 biggest outbreaks in the country, a bunch of them, if not over half of them, were in correctional facilities. And right here in Pennsylvania, where we do a really good job, and you all do a really good job. Our entire executive team has been out during COVID touring facilities, and the mask wearing levels were very good early on. The past couple months, I think all of us in the community, in prisons, we kind of let our guard down. One of the keys to this Fireside Chat is time to get that guard back up, whether you're vaccinated or not. But specifically for unvaccinated individuals, both staff and incarcerated individuals, the risk of hospitalization and death is real. And again, you're 8 times less likely to actually get the disease if you're vaccinated. But it's a serious risk. And one of the other things about this Delta strain that is concerning, frankly, is that you're seeing more kids under the age of 12 who are ineligible to get vaccinated getting sick from it. And so specifically to our staff members, if you have a young kid at home, and listen, honest to God, I believe it's your personal decision. That's my personal belief. At this point, again, we all have bosses, and if the White House or something says something, it's a different ballgame. But I believe you should be able to make that choice. I just want you to think about the implications of that choice, and whether you're older family members, younger family members. It's a legitimate risk. And we just want to make sure, I just don't want any more COVID deaths. We lost a bunch of staff. We lost some contract individuals. We lost, well over 140 incarcerated individuals to COVID. And that doesn't speak to the people who are on parole who died of COVID. There's not many families that haven't been impacted by it. And we really want to get back to the new normal, get back to focusing on getting individuals ready to be paroled and get out and be good members into the community and this and that. The path to that is safety, and we have to create a safe environment. Vaccinated versus unvaccinated staff or housing units, critical piece. There's no other way to do this. This will allow us to really focus on mitigation efforts on those unvaccinated individuals. We're going to have extra rounds by nurses. So if you're a vulnerable inmate who's on one of these unvaccinated housing units, you're going to see a nurse every day who's going to check on you, take your temperature, make sure you're not experiencing any symptoms. Our best chance, if you're unvaccinated, of avoiding you going to the hospital is finding out as soon as possible. With this Delta strain, you've certainly heard about losing your smell, losing your taste. This one, headaches and sore throat are two things that are reported more frequently with Delta. So you have any kind of symptoms, we want you to all report it, whether you're vaccinated or unvaccinated. And if you're a staff member and you're feeling like this, let us know. Let's get you tested, and let's make sure that you're keeping your family safe and keeping your coworkers and incarcerated people safe. But find out those symptoms early on so we can start treating you. We've had a really good success with the BAM treatment, or the monoclonal antibody treatment. That's had a lot of success. We believe that it still works with the Delta strain, but because the Delta strain is pretty early on, it doesn't have the body of research some of the other stuff had. So again, that's another risk that we really are just paying attention to, and really just trying to keep you all safe. That's the driving force to this. Get us to a place where 100% of staff, 100% of incarcerated individuals are vaccinated, and we won't even have to talk about COVID anymore. That's just the reality. It's over as soon as everybody gets vaccinated. Until that happens, we got to take these steps.
And we do know, and we saw this so far, the reality is there's a beginning, middle, end to everything. We've set guidelines and boundaries and procedures in place that will help us get through this faster. So what would be your kind of parting message here on this Fireside Chat to everyone out there?
So the first thing is, we're a community. Let's stop acting like we're not. We're a community. Each one of your facilities are your own kind of sub-community, but we're a community. And the only path to get from beginning to middle to end in COVID is that we take care of each other. If we're focusing on taking care of each other. And so if I hope that you look at the research and data when you're making the decision around vaccines. I hope you really do. I hope you look at it objectively. Hope you look at it at a time where you can really synthesize the information and make the best decision for you and your family. For me and my family, it's to get vaccinated. It was a no-brainer to me. I was glad to see my mom's 90, 91, something like that. If I say the wrong number, she's going to yell at me. So somewhere in that ballpark, Ma. But, I didn't see her for a year. And I was going in and out of prisons. I didn't think it was safe. And she was hurt by that. And I will tell you, the day I got that vaccination, and if you've seen the video, I was scared to death, right? I was nervous. I can't describe to you the feeling of safety and just feeling like I could take a breath for the first time in COVID when I got that shot. That's what I experienced. So again, I'd ask you to take a look and research it. And in the meantime, we're going to take these mitigation efforts. We're going to lean forward. We're going to be proactive. We're going to make sure the housing units are clean. We're going to make sure that we're telling you the why. That's what this is about. This is about me explaining to you what we're doing and why we're doing it. This is not some fake news or whatever term you want to use. I'm telling you, every decision we made in this is based on data and based on what we learned about how we need to manage this so we don't have outbreaks and we don't have deaths ultimately from COVID. That's our goal. We have the best staff in the country, maybe the world, who does corrections. You all, everybody collectively, our staff, incarcerated individuals, you all did kind of pull together. I know neither of you want to admit it, but you all kind of did pull together, and we got through COVID as good as any prison system in the country. This is how we finish. When I was a football coach, we'd say this thing, finish, and ask the Atlanta Falcons about finishing, right? They're winning fourth quarter, and Tom Brady comes back, ties it up. But guess what? We tied it up. We were way behind in the spring. We got vaccines. We tied up the ball game. I know people get tired of my sports analogies, but guess what? It's an overtime. We got a game plan. We're going to execute this game plan. So you're going to probably see this Thursday, the 5th. By the 9th, we're going to have vaccinated and unvaccinated housing unit. We're going to execute this game plan. We're going to focus on social distancing. We're going to focus on masking. We're going to do what we need to do to keep each other safe. And then once we hit, appropriate vaccination rate, so we reach herd immunity, we're going to get back to new normal. I look forward to that. And frankly, I appreciate the work all of you have done. Our staff, I can't say enough about you. I mean, listen, we had people volunteering to go into prisons before we knew what the implications of COVID was. That's the kind of remarkable folks who work for this department. We've had incarcerated individuals spending hours, 16, 20 hours out cleaning and just taking care of stuff and going above and beyond. Our certified peer specialists going around just checking in on making sure everybody's good. We've come so far. I don't want you to get in this thing like, here we go again, because that's not accurate. We're not where we were. I mean, we have about 10,000 incarcerated individuals who aren't vaccinated. We have some number of staff, it could be as many as 8,000 staff who aren't vaccinated. We had 0 people vaccinated when this started. And if you're a vaccinated, incarcerated person, you're not getting locked down because somebody 2 blocks over has COVID. You're just not. Because what we said is get vaccinated and we can get back to the new normal. And that's what we're doing for you. And the only way we can do this, the only way we can accomplish following through on what we said, and what we said is if you get vaccinated, we're going to not lock you down. We want to make sure we maximize your SL time. The only way to accomplish this is this. Now, if you're on an unvaccinated housing unit, here's what I want you to hear. No ifs, ands, or buts about it. Yes, your SL time is going to be less, especially if you have a place that's high risk. That's what we have to do to protect you. Your access to programming will not be impacted. Your access to the parole process, you will not miss a parole date because you're on an unvaccinated housing unit. You're not going to lose your work pay. You're not going to be disenfranchised in any way. You're not even going to be, there's no kind of negative consequence as it relates to access to programs, access to this and that. You're not going to work because I can't afford you having that extra risk of walking around and perhaps coming into contact with someone who, even if they're vaccinated, has the disease present and sends it to you. So that's the limitations, but it's not a limitation on programming. And although we are limiting your access to face-to-face visits, we are expanding your access to video visits. And I encourage you to do that as much as possible and keep communicating, keep letting us know. And again, we're going to provide a bunch of objective information about vaccines and the risks and the positives and this and that. And you come to your own conclusion, but think hard about it. Pennsylvania is over 60% vaccinated. Some of y'all were waiting to see what was going to happen. How long you going to wait? Okay, vaccines have been around since January. The conspiracy theories, some of them, not coming to fruition yet. So really think about it, make the best decision. In the meantime, just keep doing what you're doing. Sincerely appreciate all of you and the work you've done over the past several years, or feels like years, a fast year and a half. So thank you. And Doc, thank you for these fireside chats. You'll still be seeing your local leadership weekly to keep updating you until we truly get back to the new normal. We can stop doing this. But for now, appreciate it and keep up the good work, everybody.
We're going to finish strong. Thank you so much, Secretary, for doing this.
All right, take care.